morning, my name is Mendoza Arias Angelixa. My topic about is levothyroxine in women with thyroid, peroxidase, antibodies before concept. Introduction. The presence of maternal antithyroid antibodies is closely associated with abortion and pater delivery. Levothyroxine mitigates this risk. Even in women with biochemical normal thyroid function, studies have reported an association between the presence of antithyroid antibodies, especially thyroid peroxidase antibodies, and adverse pregnancy. Outcomes included miscarriage, preterm delivery, and other effects on non-related development weight sequelae in children.
The thyroid is a gland in the front portion of the neck, and it secretes thyroid hormone. This hormone helps control metabolism throughout the body. Hypothyroidism is having an underactive thyroid, not enough thyroid hormone. Hyperthyroidism is having too much thyroid hormone. When a patient is hypothyroid, they often can gain weight, feel lethargic or tired. They can at times have some hair loss. When a patient is hyperthyroid, they can at times feel like they are losing weight. They have shakes or tremors, they have extra heartbeats or palpitations, or maybe hot flashes. The thyroid and various thyroid illnesses can dramatically affect the success of a future pregnancy or an ongoing pregnancy. Thyroid hormone is required by the developing baby during pregnancy, and if there is not enough or if there is too much thyroid hormone, this can cause harm to the baby itself. If the mother is hypothyroid, the baby itself can be at risk for other potential harm. There can be an increased risk of miscarriage early in the pregnancy, and there can also be potential damage to the developing brain in the fetus, leading to other cognitive problems or lower IQ later in life. If the mother is hyperthyroid, there can at times be a risk of miscarriage or other pregnancy harm if the levels of thyroid hormone are excessively high in the mother. The baby can also be born with signs of Graves' disease or other signs of hyperthyroidism in rare cases. It's very important that the mother contact their physician or their endocrinologist as soon as they think they could be pregnant, because the increasing demand for thyroid hormone in pregnancy occurs very early, sometimes as early as 5 or 6 weeks of pregnancy. Our research here at the Brigham and Women's Hospital has demonstrated that the requirement for thyroid hormone goes up about 40% during the course of pregnancy. This is very important because some women do not have a functioning thyroid. If they are then taking thyroid hormone as a pill, they will need to increase the dose of that pill to be adequately normal throughout the course of pregnancy. This is very important for the baby and for the developing fetus. Any patient with a thyroid illness would benefit from being in close contact with their physician or with an endocrinologist who specializes in thyroid disorders. If someone suspects that they have a thyroid disorder, they should first reach out to their primary care physician or directly to an endocrinologist to discuss the issue. This will often lead to an examination and then some blood testing to identify if indeed there is a problem that needs to be treated.
Application in nursing. Levothyroxine is used to treat hypothyroidism and situation in which the thyroid gland does not make enough thyroid hormone.
Welcome back. You know, a hard time getting and having a baby. You say it down organ you not expect, your thyroid.
This is where the thyroid is. It's located in the neck, and we have a right lobe, a left lobe.
Yeah, it's that butterfly shape there. The thyroid is a major regulator of the body. And according to endocrinologist Dr. Claude Lardon, who's an emeritus professor at the University of Nevada's School of Medicine, Hashimoto's disease is an autoimmune condition where the body attacks its own thyroid gland. About 10% of women have this, he says. Even though their thyroid function may seem normal during pregnancy, their body could be silently attacking their thyroid, and the antibodies could endanger the life of the baby. So, Dr. Lardenois says thyroid issues need to be addressed before you ever even start to think about getting pregnant. And all women who are of childbearing age, he believes, should be tested for this antibody. It's the thyroid peroxidase antibody, or TPO.
Studies have consistently shown that women who are antibody positive have a higher risk of miscarriage.
So if you're TPO positive and your thyroid hormone is elevated, then medication early in your pregnancy may be advised. Studies involving more than 12,000 women found that thyroid antibodies increased the risk of miscarriage by, get this, almost 300%.
Pros and cons. Pros. When taken correctly, levothyroxine reduces symptoms. Lack of energy, exercise, constipation, weight gain, hair loss, dry, thin skin, increasing sensitive to cold, joint and muscle pain. Cons. Levothyroxine can cause serious or life-threatening problems when administered in larger doses, especially when taken with amphetamine.
It's the most prescribed medication in the U.S., with more than 120 million levothyroxine prescriptions written each year. The drug's purpose is to raise low thyroid hormone levels for a condition called hypothyroidism.
But the majority of these patients will be surprised they actually didn't need it.
Mayo Clinic endocrinologist Dr. Juan Brito says more frequent testing is partially to blame, as well as hypothyroidism's very common, somewhat vague symptoms.
Weight loss, hair loss, dry skin, fatigue, low energy, those are symptoms of many other conditions. Actually, they are symptoms of just life sometimes.
Dr. Brito says that's why many patients' symptoms don't improve with a daily pill. He urges physicians to have valid reasons for prescribing levothyroxine and to follow up in 3 months' time to see if the patient benefited.
And that is the key, is to reassess. The majority of patients get treated and never really have the chance to withdraw the medicine and then just get treated for the rest of their lives.
For the Mayo Clinic News Network, I'm Dennis Goda.
Is sweet applied in Ecuador. According to the ARCSA, this medicine cannot in Ecuador as Europe is not authorized since its use can cause adverse effects. Conclusion. According to a scientific study, the use of levothyroxine in elderly women with thyroid peroxidase antibodies did not result in higher rate of life with than placebo, and levothyroxine is used is discrete.